Hello everyone. Today on the occasion of Cancer Survivors Day, I on behalf of the Times of India welcome you all to the conclave Living with Cancer, a journey that only makes you stronger. I am Dr. Ananya Awasthi, a public health practitioner and the founder and director of Anuvaad Solutions that works on translating science to inform policy action on India's health and nutrition agenda. My background is in policy consulting and I have a master's in global health from the Harvard University. Starting with some context, Estimates of India Against Cancer, an initiative by a group of medical doctors and researchers at the National Institute of Cancer Prevention and Research suggests that every year almost 14 lakh new cancer patients are registered in our country. But the good news is that advanced research and development in the field of oncology has been able to evolve cancer treatment through the last few decades while increasing the survival rate of people living with this ailment. Cancer, as we all know, can affect different parts of human body. While men are more vulnerable to lung, stomach, colorectal, and esophageal cancer, women mostly fall prey to cancers of the breast, ovary, and cervix. So physicians from a wide variety of disciplines are required for managing cancer. Fortunately, there are more than one way to tackle this condition today with the ever-growing number of treatment options. Broadly speaking, oncologists usually treat cancer with radiation therapy, surgery, medications including chemotherapy, immunotherapy, and many other options as well. But keeping track of all of these options and choosing the right treatment modality necessitates a coordinated approach. This is where multidisciplinary care comes into play. Keeping this in mind, we have a session themed on the importance of multidisciplinary approach in cancer treatment. To unravel these complexities, discuss the latest advancements in medical treatment, and to celebrate the power of human resilience, let us welcome a diverse panel consisting of brave survivors and distinguished doctors from important specialties of cancer care. We have with us today Dr. Vijayashree Murthy. Dr. Murthy is a seasoned breast surgical oncologist with a strong academic background. Her expertise lies in surgical management of benign and malignant breast diseases, breast cancer screening, and personalized treatment plans. She specializes in breast conservation surgery, minimally invasive axillary surgery, breast reconstruction, and also other surgical options for hereditary breast and ovarian cancers. Dr. Murthy completed an esteemed breast oncology fellowship at the Roswell Park Comprehensive Cancer Center at New York. She also holds breast surgical oncology fellowship from Maimonides Medical Center, New York. Her comprehensive breast fellowship at Tata Memorial Hospital in India further solidified her experience in this field. Then we have with us Dr. Sachin Trivedi. Dr. Trivedi is a highly accomplished medical oncologist with experience and expertise in various systemic therapies for cancer management. He specializes in managing head and neck, breast, lung, GI, gynae, bone cancers, and even lymphomas, which is the cancer of the blood. Dr. Trivedi excels in chemotherapy, targeted therapy, immunotherapy, precision medicine, hormonal therapy, as well as supportive medicine. He's interested in cancer genomics, precision medicine, as well as preventive oncology as far as his research interest goes. Also, Dr. Trivedi holds the distinction of being one of the first Indians to work as the head of the oncology department at Nottingham University in the UK. And then we have Dr. Shyam Kishore Shrivastava. Dr. Shrivastava has over 40 years of experience in radiation oncology and currently serves as the director, radiation oncology at HCG Cancer Center in Mumbai. Dr. Shrivastava is recognized as an expert in modern radiotherapy practice utilizing advanced techniques such as the IMRT, IGRT. Dr. Shrivastava has handled over 10,000 cases throughout his career. Additionally, he served as the professor and the head of the Department of Radiation Oncology at Tata Memorial Hospital for over 14 years. He has also authored over 250 research publications and has been an examiner in multiple universities. And finally, we have with us Ms. Anchal Sharma. Diagnosed with third stage breast cancer in 2017, she is a brave, spirited cancer survivor. Moreover, she refuses to identify herself as a cancer survivor, but calls herself a cancer fighter. Despite coming from a humble background through a tough childhood, Anchal took a lead to create Canheal, which is a platform specifically designed to serve the needs of cancer fighters. Today, Anchal is an inspiration for millions of cancer fighters, and she's made it her life mission to live life to the fullest and to continue inspiring others also to do the same. With that, let's get into the panel. My first question is to you, Dr. Murthy. Cancer treatment, as we all understand, has evolved massively through the last decade. Please tell us what are the latest developments in the field of surgical oncology and what all options do patients really have as far as the immediate future is concerned. Over to you, Dr. Murthy.
Thank you, Ananya, and thank you for the kind introduction. Cancer is basically a very fascinating disease. As much as it is kind of scary, but also we have studied it so much more thoroughly over the several decades now. So much so that there are advances in every field of cancer, whether it be a surgical option or medical oncology wise or radiation oncology wise. So it has become more tailor-made and more kind of appropriate for each patient to be treated in a certain way. So to give you an example in terms of advances in surgical oncology, I mean, it would be hard to summarize everything in one go because each aspect of every organ has become a different site of cancer, having different kind of management. But I think the predominant goal that I would like to stress on is that from the large destructive surgeries that used to happen many decades ago, we have now started focusing more on organ preservation and function preservation, which has become the key thing in terms of cancer management. So whether it is a head and neck cancer, whether it's a voice box cancer where we used to take out the entire voice box, or whether we were doing, for example, breast mastectomies, to now being able to do smaller surgeries, catching the disease early and trying to preserve, because we are not just trying to give years to life, we are also trying to give life to the years. So the whole plan is to give organ preservation and function preservation, whether it's retaining the voice in case of a head and neck cancer or a voice box cancer, trying to preserve the organ in terms of breast cancer, trying to preserve the organ in terms of a limb cancer. If you have a bone cancer, we are trying to do limb sparing surgeries. Similarly, certain advanced diseases like ovarian cancer, etc., you have heated intraperitoneal chemotherapy or pressurized intraperitoneal chemotherapy, which will be done during the time of surgery. And not to mention all the other GI cancers, thoracic cancers, and gynecological cancers, where we have used minimal invasive techniques or also the newer form as robotic techniques to try and minimize the length of stay as well as the incision. So there is better pain control, patient gets back to his normal life as quickly as possible and is able to lead a healthy normal life.
Thank you. Moving from surgery to medicine, my next question is to you, Dr. Shrivastava. We've heard that even patients with advanced stages of cancer can actually live normally like anyone with like any other simple chronic disease. How has this really been made possible, and where do you see the latest advancements in the field of oncology medicine, whether you think those have contributed to this improved quality of care? Over to you, Dr. Shrivastava.
I mean, certainly over the period of time, there has been a lot of research, especially when we are talking of the cancer. And what we used to see the survival, I mean, when I started my career, a lot of patients used to die with cancer because of the lack of availability of the treatment, which is either with a good kind of surgery, radiation, or the chemotherapy. Now, over the last 40, 50 years, there have been a lot of advances. One major advances is also there in the technology, because the computers have become robust, the technology has come up, so good kind of equipment have come. Secondly, we have also started understanding the biology of cancer. So once we start understanding the biology of the cancer, it is possible that we can target the tumor appropriately so that it can be killed or it can be controlled very easily. So that has really changed the whole scenario over the period of time for cancer. Earlier, when it was considered as a dreaded disease, everybody will die. Many people used to say cancer means cancel, but today it is very different. There are very few cancers, you can call it as, where nothing can be done, but practically all the cancer, there's something available with us.
Right. That is such a right message that should be delivered through platforms as this, that cancer is not a death statement and almost all cancers are treatable to an extent. My next question to you, Dr. Shyam Kishore Shrivastava, we keep hearing about chemotherapy, radiotherapy. Tell us, and since a lot of us in the audience may not come from a medical background, if you can tell us the difference between radiotherapy and chemotherapy, and also talk about, we spoke about surgical oncology, medical oncology. So if you can bring it together for us in terms of what does multidisciplinary care for cancer really mean, that would be very, very helpful and enlightening.
Yeah, I think in your question, there are two questions. One is the difference between chemotherapy and radiation, because I think the surgery everybody understands. And second question is, what is the role of multidisciplinary team or the approach for the cancer management. If I give in a very simple way, what is the difference between chemotherapy and radiation? When I'm talking of radiation, it is something like when the sun rays are coming and you can focus it with the magnifying glass. And you know that in the childhood, we always used to play that with a magnifying glass, you can focus on what particular point, and wherever we are focusing, that can burn. So similarly, these kind of radiation, whatever is coming from sun, we are producing this radiation and directing these beam towards the cancer, so that cancer cells will die, or they can be inactivated, or they can be destroyed. So that is the way where the radiation is there. So that this is a kind of energy which we are giving it to kill the cancer cells. While in chemotherapy, these are basically the chemicals or the hormones or the biological agent, you can call it. They are either injected or through the IV line, or maybe by the syringe itself, or maybe through the mouth, so that they go and target certain area. Today's chemotherapy is like that. Dr. Sachin will elaborate much more deeper into that. So this is the difference between chemotherapy. Chemotherapy basically circulates all over the body. So even if there is a kind of cancer which is from one place to another place, it is going to target and kill those cells. Your second question was about the multidisciplinary team. In today's time, when you are looking at the kind of the information we have got, there's a plethora of information. It is very difficult for any one individual to master any subject. Therefore, each one of us, when we are treating the cancer, like you have seen Dr. Murthy is a surgeon, Dr. Sachin is giving medical oncologist, he will think about the chemotherapy and the targeted therapy. I will be there for the radiation therapy. Each field is so much advanced that we all collectively sit together and discuss about the patient. So what happens when we are discussing about individual patients, there is a collective wisdom with all of us to treat the patient. And we go for the evidence-based, what is the current evidence, what is the current research there, so that the treatment is totally unbiased and it can be really given to the patient in the best way which is possible.
Right. My next question, and probably something that most viewers would like to know, Dr. Trivedi, is the incidence of cancer really rising at a very alarming extent in India? And if so, can you elaborate on the causes? And as a cancer specialist, what's the message that you have in terms of early diagnosis and whether or not that can improve cancer survival in India?
So thank you, Ananya and TOI, for inviting us for this wonderful webinar on this very important day. And let me start by congratulating Anchal for being an inspiration to several possibly several patients who might come in the future, but many people who are actually fighters like you. It is very important for people to know that you can fight and live normal life, and possibly live the life to a better extent and to fulfill your potential. So, your question about the incidence, I'll just quote you a very scary figure, okay? 1 in 2 people, according to CR UK statistics, are going to get cancer in UK. Can you believe that? I mean, I couldn't believe it when I read it for the first time. But if you just go on the CRUK website, you will find 1 in 2 people. That means half of us, even in this meeting or even unfortunately in this audience, are likely, I'm not saying they will get, are likely to get a cancer. I hope no one gets it, but are likely to get a type of cancer in their lifetime. Okay? And based on the figures that were available until 5 years ago, 1 in 3 people were going to succumb to it. Okay, but it will be an understatement to say that we are at the cusp of revolution in terms of management of cancer. We are actually in the middle of a revolution. Now, what has happened is that if you look at the knowledge curve, normally what happens is you get a linear curve and suddenly you got an exponential rise in the knowledge base that you get. And this is what we are witnessing in all areas of the world. Okay, now, unfortunately, the incidence of cancer is also rising, and there are many reasons to it. Okay, one of the reasons which you will, if you look at what is happening in the Western world, is consumption of unhealthy food intake, more intake of alcohol, more intake of tobacco, but also the fact that people are living longer. So in the past, people used to actually succumb to things like malaria, TB, cholera, and those kind of things. We now know how to counter it. The average life expectancy is growing. What that means is your body and the cells in the body have got a longer time to actually develop cancer. So as much as we may try, there are many things that we can do. We can modify our lifestyle, we can actually try to prevent it, but many of us are going to get cancer. And the key is early diagnosis. The reason I say that, if I could share some statistics with you, the stage 1 breast cancer survival versus the stage 4 breast cancer survival, hugely different. And that is reciprocated in almost all different types of cancer. I'm not saying that if you got a stage 4, we may not be able to do anything, and I'm not saying if you got a stage 3, we can't do anything, because for a stage 3 cancer, you need a very good team to actually manage, and you can actually is the best evidence of that is if you get a good team, if you got all the right technologies and implement all the right kind of strategies, you can still get rid of cancer. But again, earlier you diagnose, the better the chances of a cure. So what we could do, or what we as oncology team would like the general public to understand and do is, one, I think, is to create awareness, and I think that is what we are trying to do here, is for everyone to understand not only why you get cancer, but how you can actually identify the symptoms. Okay, so being vigilant about symptoms and having appropriate screening strategies. So we don't have screening programs in India, and it is completely dependent on the individual. So what I find is people delay reporting to a doctor if they've got any symptoms. And my take on a simple message would be, if you got any symptom that shouldn't be there for more than 2 to 3 weeks and you don't know the reason for it, you just go and see your doctor. Do not delay. And then the doctor will take the appropriate steps of screening, doing some tests, and then making sure you're safe.
You spoke about early diagnosis and how that could be key to successful treatment outcomes. Holding that thought there, back to you, Dr. Murthy. Breast cancer is so rampant in the country, and there's also a lot of taboo around whether or not women are comfortable showing themselves up or recognizing. So to all the women who may be watching this webinar, what is your message for really early diagnosis and catching the right symptoms as far as breast cancer goes?
So as Dr. Sachin pointed out, right, the earlier the diagnosis, the better the chances of survival, the longer the chances of survival, and a meaningful survival. Because now what has happened is, for example, 1 in 8 women are generally diagnosed with breast cancer in the US. Here you have about 1 in 28 women in India, which is an enormously huge number because we have a larger population. It wouldn't have been considered so if it was in the Western countries. But 1 in 28 women is a fairly large number. And what happens is, every day, 1 in 3 minutes, a woman is diagnosed with breast cancer in India, and 1 in every 14 minutes, a woman dies of breast cancer, which is also an alarming rate. And the reason for that is there are multiple reasons. That there is, a hesitancy to come and show one of your private part organs, and also there is a hesitancy in trying to accept it. There are times when they think, because most of the times a breast cancer will present as a painless lump, so it's not causing any pain, it's just something, maybe it will go away. Or there are certain times where even if they come to know of cancer, there's a little bit of denial, there is a little bit of approach towards using some other means of complementary medicine, etc. But I would suggest a few things which are very, very key in terms of breast cancer diagnosis. So one is to have a good awareness of breast self-examination, which should be done by every woman after the age of 25. So she should be able to feel every part of her breast in a shower, one time in a month. Maybe if you're menstruating, a week after your periods, because during the periods time, the breasts are generally a little bit more painful and tender. So try and see both aspects of your breast, behind the nipple, in the armpits, etc. And then once in a year, whether it is a female doctor or it is a male doctor, whoever is your primary care physician, get an examination done by the physician themselves, just to make sure that everything is going okay. And I would recommend at least once a year or once every 2 years, a screening mammogram to be done by every female after the age of 40. So this way what happens is the tumors which you are actually going to feel, that may be sometimes 2 centimeters, 3 centimeters and above. Whereas with a screening mammogram, you can detect tumors as small as 3 millimeters, 4 millimeters, 5 millimeters. So you're opening up a whole different kind of exposure to them, where we can get away with very small surgeries. We can get away sometimes, for example, de-escalation of chemotherapy, de-escalation of radiation. If it is a hormone positive tumor, we can just put them on pills and they can go about their normal life. And if in case there is an advanced tumor also, I'm not trying to say that all advanced tumors are very sinister. Obviously, to a certain extent they are. But I would say that we still have a lot of options where we can still do a surgical treatment. We can give some chemotherapy, shrink the tumor down, and then we can always do some sort of a reconstructive surgery. But all I need the women to understand is, whatever may be the case, whatever may be the stage, we are here to help. We are here with the treatment options. So don't hesitate in going and show.
Thank you. This is very, very helpful. Now to our most special guest, Anchal, Miss Anchal Sharma. I was really, really inspired when I was reading up about you. And of course, we are, as moderators, are given scripts that she or he is the cancer survivor and you have to invite them. And when I was reading up about you, the first sentence was that you don't identify yourself as a cancer survivor, but as a cancer fighter. So educate me and educate the audiences. Why this taxonomy?
So, I always say I'm a cancer fighter. There's a reason why I say this, because fight against cancer is a one thing, right? But fight against emotional, physical and mental well-being is the bigger fight. Because there, as a cancer fighter, most of the people, they lose hope. Because once they heard this word cancer, they thought now we don't have any life left, and cancer means we are going to die. So that's the reason which make me more vocal about the subject. And I think I'm enjoying the beautiful life post cancer. Before cancer, I was living a life which is more of like a machine, not taking care of myself, not doing things which makes me happy, taking stress necessary and lots of other things. But post cancer, I realized one thing, that my body is my first priority, which we majorly ignore. We are spending on brands, but we don't take care of our body, which is according to me, my body is the biggest brand for me. And I don't know how other people take, but I always say you have to be strong from your mentally and physically, because we have Google and people free who are always there to interfere in our life and give necessary gyan. Though all the experts are there, I'm so thankful all of the doctors, they are talking so practical. Because Ananya, I meet lots of cancer patients, I do lots of counseling, and trust me, when I see people that their family and relatives suggest them to not go to doctor, but first they refer them to meet a cancer survivor, which is also a wrong approach according to me, because we are not professionals. Professionals are doctors, right? But their first preference is go and meet the survivors, send them their reports. In fact, I'm getting lots of reports like, ma'am, this is my report, please go through and can you suggest me what should I do or not. I am not a doctor, please understand. I am a survivor. I can share with you my journey, my experience, right? But I cannot give you the right advice on your treatment. Then people go to Babas. Those Babaji, I have been there, and my this thing, that lump disappear completely. But we have to understand, human body is so I would say magical, and we have so many lumps which are developing in our body, but everyone is not meant to be cancer. So there are many lumps which disappear because they meant to be disappear, and they are not cancerous. Right, ma'am, if I am not wrong? But people share their experience that, oh, I have been to that Babaji and my lump is completely gone, though it was not a cancer. So yes, be a fighter, not just a survivor who listens everyone and just follow them blindly.
Right. No, this is so true. And I think what you were saying is also part of the reason is that, of course, cancer is a scary disease, so to speak, and people are looking for emotional support.
People are not educated. People don't want to talk about the disease. Right now there is so much of cure, there is so advanced treatments are there, but we have been taught like this, like, in fact, I would say the family put the first pressure. If a girl who's under 30, she's not allowed to tell outside that, oh, you have diagnosed this with cancer, beta, don't share with the relatives or a family, just hide yourself for a year or two inside the home.
Right. So how do you fight such societal stigmas? You just mentioned one of women at a marriageable age, and when it's hush hush, don't tell anyone that you have cancer. How have you fought those societal stigmas in case you faced it? And then how do you inspire other cancer fighters to fight that out, to fight that battle out?
See, I only share my journey. I'm not expert, and what I learned from my journey and from my day-to-day life, acceptance is the first thing, right? If I cannot accept myself, no one else in the society do whatever. Wear most expensive brands, wear most expensive clothes, no matter you have a most expensive car. But if you cannot accept yourself, nobody will accept you, first thing. I embrace all my faces. No matter when I was going through a cancer, I used to wear my best dresses, my best makeup, and I never wear my wigs or anything to hide myself. Why? It's my body and I have to respect that. So that acceptance make my journey more and far easy than other cancer patient. And second thing, you will be surprised, I found a love of my life during the cancer when I was almost on my deathbed. This guy got impressed with my smile and the way I'm dealing with cancer.
Wow. Yes. No, this is so inspiring. And I mean, did that inspire you to come up with Canheal? Tell us more about Canheal and what does it offer?
Canheal is also very close to my heart, and because I have been through that journey, so I know there is no such platform where a cancer patient can go and find relevant product which they need during the cancer and post-cancer surgery, right? Like we design special apparels which people can wear. You never heard of maybe chemo clothes and radiation clothes. So we design them for them, and we'll see case to case, like what person is going through which cancer surgery, which part of the cancer. So we design clothes accordingly, and the whole idea is like when I was going through my chemos and radiation, I used to see lots of people are wearing many fancy caps, and some cool caps are there, and some other gadget which meant to keep their head cold, and then they were like, okay, if I wear this, my hair will not lose. Okay, and I was curious to know what is all this and from where I can get. A girl like me who don't have reach to order from out of India. How do I get this, right? And from where I get this? So since then, my curation began, and I start doing more research. I start talking to the patients. I start talking to the doctors. And then when my radiation part came, by the time, I need a special clothes which can be more soft and a loose, and with the special access, because I was not able to move my body properly. So I saw there is hardly anyone who can understand what I need exactly. So then we start developing these things. Then we come up with the concept called comfort cushion, because a girl like me who's working throughout the cancer, if I'm driving and I have a chemopod is not an easy thing, right? It's a very painful procedure throughout. So and I have to drive because I don't have anyone. So how do I wear a seat belt without that pain? So we design a seat belt comfort cushion which can give a space between the belt and the chemopod. So these are the few products. We design lots of products which can be needful, and we have a culture. When we go, we don't like to go empty handed, no matter where we are going, whether we bring fruits or anything. So our whole idea is to get them something which can be useful, which can give them hope, engage them, and that can make their journey easy and comfortable. So yeah, that's what. And we are developing a community. There is no such community where people come openly and share their journey, because still their family and relatives are like, please don't tell anyone, who will marry you, and there will be a problem for you. Nobody will accept you because you might not able to produce child for me. So we are working on those stigmas also parallelly through the Canheal, because we are developing a very strong community, and where we are creating event and awareness about the subject, like you can live normal and a better life post cancer, not just regular life.
Right. Wonderful. Such a wonderful message from cancer, being a cancer survivor to being a cancer fighter, and not a normal life but a better life with the cancer treatment. This is such a great message. Going back to medicine, Dr. Trivedi, tell us a bit about, we've heard about it or read about it a little bit here and there, but we don't probably understand too well, what does immunotherapy really mean? And other therapies like targeted therapies. What are some of these latest advancements in the field of oncology medicine?
That's a very interesting, and I try my best to answer as briefly and as simply as possible, because like I was explaining earlier, we have so much information about why cancer develops, how it develops, what are the errors, and what we can do about it. Okay, so there are two things. One, we know cancer basically is a disease that arises from a genetic error in that particular cell. Okay, I'm being very precise about the genetic error in that particular cell. That doesn't mean that this is a gene that is passed on. Okay, that's completely different. You got a cell that has genetic material, there's an error there, and these errors, these are called as mutations. Okay, that is one of the main mechanisms of how the cancer develops. What we can do now is identify those errors, and we have specified targeted drugs that just targets the error in that gene or the product of the gene. So that is what we call as precision medicine. Okay, but precision medicine at one time used to be like, they thought it is going to be a panacea, so you're going to be able to do everything just with precision medicine. But cancer is a very fascinating disease, like Dr. Vijay said, that because it learns how to actually overcome these drugs. So the cancer can transform itself from one type to another type. Okay, now this is what we call as cancer heterogeneity. Okay, so the precision medicine on its own is not going to cure everything. It will work. It does do wonders, but that is not the only solution. It has to be combined with what we call as multimodality. So surgery, radiotherapy, precision medicine, chemotherapy, and now immunotherapy as well. Okay, so precision medicine is about targeting those specific errors and utilizing that information to get rid of the cancer cells. Immunotherapy is something which is a very interesting thing. What it does, it utilizes your body's own immune system to kill the cancer cells. So one very fascinating thing about cancer is that all of us may have some cancerous cells developing now and then, but our body is able to fight it and get rid of it. However, at certain points, some cancer cells develop this ability to hide themselves from the immune system. So it's like, you got a thief going into a crowd and just walking like a normal person, behaving like a normal person, and the police will not be able to identify that. So it hides itself by certain molecular changes. And what we can do with immunotherapy is we can remove that mask from the cancer cells, and the immune system can identify those cancer cells and kill it. So this is in a nutshell what immunotherapy is and what precision medicine is. But what Anchal was describing, so this is the age of having personalized, tailored, precise therapy, but having a patient-centric approach. So keeping the patient in the center, that is what the ethos is, and that is what we try to do as an MDT. So when we meet as a team, the whole team, so one very interesting thing that I want public to know and I want patients to know is that, so we may have a half an hour, 1 hour consultation with the patient, but behind the curtain, the whole team is working all the time for improving the outcome for the patient. So we meet as a team, we've got different specialists. So this 3 of us are part of only a small part of the team. We've got psycho-oncologists, we've got dietitians, we've got nurses, and then we've got other junior doctors, and all of us sit down and develop one strategy, deploy all the technology, and try to improve the outcome. So this is immunotherapy and precision medicine is an add-on to what we were doing before.
Thank you so much. Dr. Shrivastava, any final thoughts on some of the latest advancements in the field of radiation that you think would be helpful for viewers to know about?
Yeah, certainly. I think before I go to the advances in the radiation oncology and the technology, I'd like to really congratulate again Anchal, and a remarkable thing which she has really mentioned this. And one thing very specific which I have gone through and I have found in last 40 years of practice, that if the patient is positive, things are also positive. And what I found that how the Anchal was really working with her disease, the treatment and everything, she has been positive all through. And we have seen many patients who have been positive. Sometimes the unexpected thing happens that they become all right without much problems, without much complication. So it is extremely important that the patient has to be very, very positive during the treatment, and everything, whichever the patient feels about that, they should discuss with doctor so that doctor can also get some answer. And in their positivity, the doctors, as we were saying, not only the doctor, but patient also help for themselves to be cured or something like that. As you asked about the development and the recent advances in the technology, as I mentioned earlier, there have been a lot of advances in the last 20-30 years. One mainly because of the computers have become very robust and very fast, so that things can be analyzed much faster and interpretation can be done. Similarly, technology like robotics and other things have come up where the things can really do a wonder. And especially I will talk about the radiation oncology. What we used to practice around 40-50 years back, today the technology is extremely different. And as I mentioned, that whole thing has been begun that we want to have a precision in the treatment, so that we are focusing the treatment part, as Dr. Trivedi also mentioned, and Dr. Biju also mentioned about that we are going to have the patient-centric, so that patients should have less complication over the period of time. They should go back to the society, and our main aim is that control rate has increased definitely, but the quality of life has to be maintained for the patient. So that's very important. When you look at the technology, and several advances have come in this, and we can give you one simple example in radiation therapy. The latest machines have come up where the the radiation can be focused to the tumor so that normal tissue can be saved. And one example is like cyber knife, the gamma knife. These technology have come up where the high dose of radiation can be given to the tumor area, and we can save the normal structure so complications are less. Similarly, one major thing has also come that we have started understanding more of the biology of patients, especially when I say about radiobiology of these patients. So that earlier what we used to do radiation therapy, I think I'm not sure what Anchal has received the radiation therapy, but earlier we used to give 5 weeks or 7 weeks. Now it can be done in 3 weeks time, and people are trying that the whole radiation doses can be given in 1 week, or maybe in some time, maybe in one shot itself. So that patient need not to stay away from their home. And if somebody is coming to Mumbai from, say, somewhere in Bihar or Uttar Pradesh or Bengal, and they are spending 1 month here, now it can be done within a week time, so they can go back. So that saves a lot of things. One is the patient time. Secondly, the money is also saved, and they can go back to the society as early and as quickly as possible.
Thank you. And finally, you also touched upon the whole idea of affordability of treatment and how such latest advances can actually, in at least in Indian context, go a long way that more people receive cancer care to the best of quality. With that, we come to the end of this particular webinar. Thank you so much to our panelists, to Anchal, for this interesting and very, very informative session, and to the viewers. Hope we've been able to break down the scientific nuances of cancer treatment in easy, simple to understand language. Most importantly, we have the message loud and clear. Cancer is not a death statement, and that there is life beyond thanks to advances in medical treatment, and most importantly, to the power of positive human spirit. Thank you so much.